Hey, Bobby Halton here, and welcome to today's Hump Day Hangout. It's going to be an incredible hangout. We've got some great folks who are going to talk to you about a pressing issue in the American Fire Service. We're going to talk a little bit about mental health today. And as we go through it, we're going to be talking about solutions, right? It's time to quit ignoring the problem and start talking about what we can do about it, how we can create a better environment for people, how we can help people stay healthy, how we can do better, right? Generally speaking, we all realize there are issues. There are always going to be issues. So we brought together some great people who've been dealing with it professionally for a really long time, as well as some firefighters, who's been dabbling in it, and DeGryse, who's actually been involved in it his entire life, who's a Battalion of Chicago. We've got Father Jim, and we've got Jada Hudson, and we've got some other guests who are popping in and out. I'll be popping in and out. So I think it's going to be a great day. One of the things I'll let you know is that October, was it 15 and 16, Dena? 15 and 16?
That's right. The 15th and 16th.
15 and 16, we're going to be in Raleigh, North Carolina. We're going to be having a Florian symposium there. We've got some great speakers lined up with solutions, right? Things you can do, actively do, not react, proactive stuff. So, we're done talking about reaction. We're trying to talk more about proactive stuff. So I hope you enjoy it. We've got a great lineup here. I think it's going to be an interesting conversation. So with that, I'll throw it to Dena. And Dena, why don't you go around the horn, introduce everybody, and let's get started.
Awesome. Thank you, Chief Halton. So we're lucky today because we have several members of the staff from Rosecrance Florian here. We have Father Jim, we have Jaden Miller, and then we have Erica Gilmore. And I'll let each of you guys introduce yourselves and talk about yourselves and what you do. I think one of the neatest things about what we're doing today is we're not just talking about the problem of mental health in the fire service, but we're also talking about the solutions that are available and what options we have available. And I can't be happier to have these people here with us because they are so smart, and I'm happy because I don't have to talk a lot because they have a lot that they're going to be able to offer for us. So if you guys don't mind, we'll just go from you, Jada, to Erica, to Jim, and let you guys introduce yourselves.
Sure. I'm Jaden Miller. I'm an art therapist and licensed counselor, and I've been at Rosecrance here for a little over 8 years. So mostly I work with all the clients that come in, and then Florian once a week, and then also if there's any military veterans within that bunch, we've been bringing them to equine assisted therapy as well.
And I'm Erica Gilmore. I'm the coordinator of the Rosecrance Florian program, and I'm also a licensed counselor. Been with Rosecrance about 3 years, with an extensive history in counseling and therapy, and yeah, that's what I do.
Cool.
Father Jim.
Father Jim Swarthout, Director of Clergy and Alumni Relations for Rosecrance. I work on the Florian program. I'm also a licensed therapist and counselor for quite a long time. I did my clinical work at Johns Hopkins over 30 years ago. But my work really is to align a lot of different issues with addiction and mental health. But I'm honored every week to be able to be the chaplain on the Florian program and to work with trauma issues, as well as I'm an international chaplain for the pools. So I'm involved with the pools, the Federation of Leatherheads Society throughout the country.
I think you're going to get fired for not making the symposium.
I know that I did that wrong. I have my badge on right here. So if everyone wants to see the pools, right here.
So I think the unique thing that we have today for the viewers is actually having people who spend their day every day kind of providing treatment, providing sources and resources for people who are suffering. So what I hope today is anybody watching will just ask some questions, because that's what we really want to do, is we want to answer the questions that are out there. I have a lot of ideas in my head, and I don't think you guys want to hear everything that I have to say.
Yeah, no, you're...
Erica, we don't see you too well.
You don't see me too well?
Yeah, there you are. Yeah, all I see is like your right eye, and that's about it. But now we just lost Jada, but that's okay. You guys will make it.
Okay, we can just like get real close.
So I know for me in North Carolina, a lot of people don't even know what treatment is out there, and especially treatment facilities and treatment facilities for first responders. Whenever I tell people about Rosecrance Florian, they're really confused, but then they get really excited to hear what you guys have and why it's unique and why it stands out. So can one of you guys just kind of talk about Rosecrance and talk about the Florian unit a little bit?
Yeah, so Rosecrance has been in business for a little bit over 100 years. It started as a orphanage, specifically, the Rosecrance Florian program is treats uniformed services, so firefighters, police officers, EMS, military personnel. Rosecrance, in general, services both mental health and substance abuse. The Florian program, you have to have a primary diagnosis of substance abuse, but we also do address the co-occurring issues that people suffer with, and one of the primary focuses of the Florian program is to look at and explore the career-related trauma and how that impacts their substance use and unhealthy coping skills, and how they can kind of work towards recovery in that regard so they can return to work and maybe recognize those symptoms as they continue in their career.
Okay. And I remember I heard you talk once, and you were talking about the co-occurring issues and what you guys do, and you compared it to the chicken and the egg.
Yeah.
Can you talk a little bit about that and what you mean by that?
So it's kind of a hot topic, co-occurring, meaning that somebody has both substance abuse problems and mental health problems. And it's really difficult to identify what kind of happened first. So sometimes people used to self-medicate their mental health issues, and then sometimes people's mental health issues are, okay. So sometimes people use to cope with their mental health issues, and sometimes people's mental health issues cause them to turn to substances. So it's just kind of, it's hard to identify what happened first. And the thing about substance abuse is using substances changes the chemical makeup of your brain. So it can create depression, it can create anxiety. And when somebody walks in our doors, we don't necessarily know which one started first. So it's really important to address both of those things at the same time. I don't know if that answered your question.
No, it did. And it makes a lot of sense, because I think something that I'm learning, and the mistake that we fall into, is in public safety for firefighters, police officers, paramedics, all of that, they think that their issues should all come from trauma and from the stress of the job. And they don't realize that, or at least what I'm learning is, we don't realize that we're actually normal humans like everybody else, and we're going to have the same problems that other people have, and that sometimes those problems can actually make work more stressful, which can actually lead to what seems like post-traumatic stress, but it really was rooted in issues in our personal lives. Do y'all see that?
Oh, absolutely. I think part of the job of being a first responder in particular is being able to turn off that empathy piece, being able to go into a call and not be completely overwhelmed by your emotions, so that way you can kind of identify the problem and fix it. The problem with that is it's not like a light switch. It's not like something that you can just turn off when you go home, which creates a lot of difficulty in connecting with family, children, and spouse. And so it creates a lot of relational stress. And one of the risk factors for somebody developing PTSD or any other mental health issue is just elevated levels of stress. So say you're having difficulty with your spouse at home. If you go on a bad call, it's going to be harder for you to process it and work through that stress in a healthy way.
No, that makes so much sense. So what have you guys seen on this end? What leads more to having post-traumatic stress? What would make somebody more susceptible to that than other people?
A prior history of a mental health diagnosis. If you're talking about first responders in general, one of the things that they have identified is how connected to their department they feel, how supported by their department they feel. Gender, women are more likely to develop PTSD than men. Substance abuse, that kind of thing.
So what are things that we can do to prevent that then? Like, if we understand that.
So I think it's important that people have healthy routines and healthy coping skills in their life. I think it's important to understand what your family history is of mental health and substance abuse issues and kind of have a good idea of the reality of where you're at and the impact that these experiences can have on your mental health and just overall stability. Being able to have a positive support system, feeling like you have people in your life that you can talk to and reach out to. Yeah, just generally, one of the biggest things that I've read, and I've done a lot of reading on post-traumatic growth recently, is that people who have hope for the future and have a more positive outlook on things are less likely to develop PTSD, or if they have PTSD, are more likely to develop the post-traumatic growth.
Yeah, no, definitely. So, and I guess I've been the same since. I've been doing some of that reading. And one of the things I found, I read an article that just came out this year, and it actually identified positive support from your supervisors is one of the greatest things that will prevent post-traumatic stress disorder.
Mm-hmm. Yeah, I think just feeling, I think for people when they go into traumatic experiences, knowing that it's going to be a traumatic experience, there has to be a sense of safety. And they have to feel like they're going to go into this and they're going to survive. And that they're going to have the help that they need, and the team is going to work together. And essentially, having a positive, supervisor, having the administration kind of back you and be there to support you is going to help contribute to that overall sense of safety.
That's definitely what I've seen, and I think that's why we wanted to have this conversation and bring people together. Is the issues that can lead to post-traumatic stress disorder a lot of times arise from us just not dealing with things that bother us, trying to hide them, trying to ignore them, trying to be ashamed of them. And it's everything from a traumatic call to something in your personal life. A lot of, I know Chief DeGryse shared his data from 20 years of data that they collected at the Chicago Fire Department. And on there, their number one issue was relationship issues. Mm-hmm. And before it was post-traumatic stress, they had alcoholism, legal problems. So what I see from that, and my kind of takeaway from that, is we in public safety are affected by so many things that the general population is affected by, but we're just less likely to admit it.
Yeah, I think it kind of goes without saying that the first responders are the people who, they fix the problem, and it's really hard to admit that you need help. And there's like a sense of control that comes along with the job as well.
But I think it's interesting because earlier you were talking about post-traumatic growth, which I think is really important. Mm-hmm. And people jump to these titles like PTSD, and they assume because they're bothered by something or they're struggling with something that they suddenly have some diagnosable condition. And I don't think that's true. I think that life is a struggle. It's always a struggle. You go from struggle to struggle to struggle. What defines you is how you deal with it. Now, obviously, there are some things that are sentinel events for people that cause them to have really serious issues that they need professional help for. But a lot of the stuff that I hear now, it's like just stuff that you're going to go through. And if you have a just culture, like everybody was describing, supportive environment, good relationships with your family, that post-traumatic growth stuff, Tedeschi and Calhoun in 1990 coined that term. If you look at that, that's as old as the Iliad and the Odyssey, Job, Beowulf, Gilgamesh. I think that, we got to be careful about people going to these clinical labels for just like normal life, for God's sakes. You're not going to be happy every day. I woke up today, I'm pissed off because I'm at work. Okay, deal with it. I'm not really, but you know what I mean? Not every day is going to be, I'm so glad to be here. Oh, I love you. You look great. You're going to get old. You're going to gain weight. Your kids are going to hate you. Your boss is going to be a jerk. Okay, live with it. You don't like your neighbor's politics. You don't like the president. You like the president. You don't like the whatever. Doesn't mean you're nuts. It doesn't mean you need to go lay on somebody's couch or seek help. I mean, some of that stuff, I just think we're overblowing it to where, suddenly I saw a thing the other day where somebody said 85% of firefighters are dealing with PTSD. That's not true. 85% of firefighters are regular people who are going through crap. The other 15 are lucky because right now they're not going through anything. They're in love or they're 23 and single and stay that way. Don't get married, don't have kids. That's my advice. You want to avoid stress, don't get married, don't have kids. But So I think it's kind of fun because when we get together in Raleigh, I want to talk about that. I want to talk about life's a struggle. I want to talk about it's how you deal with it. It's about having a great network and great people rather than saying, oh my goodness, I'm a victim. Oh, everybody hates me. I'm a Catholic Irishman, so I'm discriminated against by Episcopalian Germans. God's sake. At some point, we got to tell people to get over themselves, and then because we diminish the people who really are going through some difficult stuff. We diminish the people, when we all decide we're struggling, we diminish the people who really are. And there are some folks among us who are having a hard time, right? So because maybe too many things came together at once. And I just think we got to be careful, right? So that's why I love having Jada and Dan on, because you guys can really define, what those conditions and Dr. Jim, Father Jim, Dr. Father Jim can really tell us, hey man, what's that? What is that tipping point where like maybe you better go like sit down with somebody like Dan or Jada or Father Jim and have it out versus just sitting around the table and saying, man, I can't stand the chief, or I can't stand the captain, or my wife is giving me a hard time, or my dog, continually bites me. Well, okay, that's just like normal stuff, right? And we conflate that stuff up to a level where, man, if you think life is going to be unicorns and lollipops, man, you're an idiot. It ain't. You know what I mean? It ain't fair. It ain't easy. And the sooner you deal with that, then you're gonna be a lot happier.
Oscar Wilde uses the term perfectly, Bobby. Oscar Wilde, life is too important to be taken seriously. This is serious work, but sometimes we navel gaze stuff where there's a big picture and that we're like a firehouse family of faith. I think a firehouse is of a family. And sometimes even in our own families, we struggle and we battle and we push and we pull. We have new people in the family, but also we need to be aligned to the family. And some people have issues, some people don't have issues. And our role really is to sort of have each other's backs and hearts in many ways. But we do sometimes navel gazing, but there's addiction and mental health issues, and we all have a right to have joy. And that's where I think sometimes we navel gaze. Sometimes the clinicians will say, or a everybody comes in and says, I have PTSD. And I'm like, wait a minute, have you talked to a doctor about this? Psychiatrist? There's things that I do and things that you do that we're good at. And we humbly listen to each other's minds and hearts. I think that's important. Danny and I did a group the other day together, and it was really a meshing of people's experiences together. And I think that was the beautiful part of that moment. Our role in clinicians, therapists, people of faith, and it's really about a family house, a firehouse family of faith. Diversity, yet unity. Danny, are you going to talk or are you just going to listen? Danny's not going to say anything.
We need to let him introduce himself.
Yeah.
Sorry for the rant, but I agree. We're a family. So docs, tell us what's really clinical PTSD? What's that tipping point where we really need to get serious about getting help versus just like get over it kind of stuff?
So let me just jump in real quick in case I got to fly, but sorry I'm late. Sorry I missed the introductions. Everybody that's out there, welcome to the Hump Day Hangout with this great group. And let's stay away from labels, okay? We'll just kind of have a discussion about what's going on and really kind of what the current what's currently going on, and not overstate it. I think that's what me and Bobby talked about. That's what we try to do in peer support. That's what we try to do with clinically. And let's just have a discussion. So we're not doctors, Bobby, clinicians per se with various levels. And actually, I'll defer that actually to Erica and let her kind of define, because PTSD, obviously it's changing in DSM, but she's worked clinically with a lot of first responders and military personnel, so I'll let her kind of answer that question.
You know, Bobby, I really agree with your statement about people being overdiagnosed. I think when people get diagnosed, they find comfort in it because then they feel like if I can identify the problem, then you can give me a pill and then that's the solution. But unfortunately, it doesn't really work like that. And what we try to do is have them not get really caught up in the labels because that's not what's important. The problem is not what's important, it's the solution that's what's important. I think in regards to when does it become a real significant issue is when you start seeing issues in your personal life, in your professional life, when it starts impacting your ability to perform daily tasks, when it starts preventing you from engaging in things you typically engage in, when you feel like you're having a struggling relationship with your significant other, when you're not enjoying work, or you're drinking before work, drinking at work, drinking too much after work, and it's impacting your ability to stay focused or do your job the way that you need to. I think only the person that's struggling with it can really know when it has gotten to that point. I think people sometimes see the issues in their life and then, you know, they magnify it. They think that I'm struggling with this, I'm going to go to the doctor and I'm just going to get the quick fix so I can deal with it. Or they do the opposite, where they see little things in their life and they think that they can fix it, or that things are going to get better, or that they're going to break habits. And it just kind of increases because substance abuse is a progressive disease. If you don't address it or develop new ways of managing it or coping with things, it just gets worse. So unfortunately, a lot of times by the time some things get bad enough that somebody determines that they want to get help, they've already developed a mental dependence and a lot of times a physical dependence. But in regards to when does it become a very serious problem, I think only the person struggling with it would really be able to know, if that makes sense.
That does. And you know what I think is really fascinating and incredible is everything that I've learned, and I think that most of us have learned, that can prevent any sort of mental health disorder are typically a lot of the same things that help cure them. And then on top of that, and I don't know if you guys agree, but no matter what the label is or what the problem is, the treatment for it all is about the same: positive social support and methods of coping. And that's kind of what you guys do, right?
Yeah, so I mean, that's primarily what we do. We do have a psychiatrist here that our clients can see, but what we use evidence-based manualized treatment programs to help them develop coping skills based on what works for them. You know, there is not a whole lot of evidence that says that one particular therapy is the most effective in treating people with mental illness and substance abuse, but we do know that therapy is effective. So we try to teach them with provide them with a lot of different kinds of coping skills and different kinds of therapy to make sure we find something that they feel positive about and that connects with them. And that's kind of like what Jada does. I can let her say a little bit about what she does. Is it still on? Yes.
Yeah, so mostly when I work with the guys and gals here, it's going to be in the art therapy room, art therapy setting, but also a lot of informal downtime with verbal therapy too. So, you know, talk therapy sometimes is difficult for clients coming in, so we offer the alternative where they can express themselves through art or music or fitness, physical means. So really giving them a wide variety of ways to express themselves.
Yeah, we have a huge experiential therapy department here at Rosecrance, and that is just about finding alternative ways of connecting with your feelings and connecting with the present moment, because sometimes that's really hard for people. A lot of times with the first responders that we see, they have spent so much time trying not to feel their feelings, they can't even begin to start to. Like, they want to, but they just don't even know how to tap into that side. They've been trying to disconnect from it for so long. So the art therapy, and then we do yoga, and we do this thing called labyrinth, where they kind of walk through a maze and it's meditation. We do drumming therapy, and then the equine therapy. All that stuff is just an alternative way of helping them learn positive ways to de-stress and cope with things. without just simply talking about it.
Right. And when I came to Rosecrance, I was able to see the art that you guys did. And I saw one that really kind of stuck out. It was those masks.
Okay.
Can we talk about those a little bit?
Yeah, so a common group that I'll do with the guys, they're basically a mask that represents kind of their external self as well as their internal self. So outside of the mask, they construct them. They'll do plaster Paris or their work over top of a mold, but they talk about and address, they represent the mask that they've been wearing. So for many of them, it's going to be humor, right? We put on that funny face, that funny mask, that superhero, that bravery, kind of that diamond-plated strength, you know, superhero-like. And then on the inside of the mask, that's where they get to kind of address the things that they've been struggling with, hiding, pushing down, avoiding. And that tends to be a pretty vulnerable directive and conversation for them. So with that, we get a lot of guilt and shame, a lot of anxiety. Fear is a huge one. Fear of failure, fear of addressing concerns, fear of not being good enough. And the art serves as an indirect way that they can talk about themselves. So they're not directly having to sit down, talk one-on-one, face-to-face with a person. They can kind of talk about themselves through an art piece. And it's kind of a way they think I trick them into opening up about themselves. It's just a little bit safer way. And then sharing, you know, in the community in a supportive group, others will join in. And it tends to be a pretty enlightening directive for them, as well as a few other ones that we'll do. But, you know, they're able to communicate and see that they're not alone, that other people have these very similar feelings. And I think that's reassuring for them.
You know what I thought was actually, I guess, more impressive about the masks is they don't even help the person that's drawing it the most or creating it the most. I know when I was there and I looked at it, I took a few pictures and shared it. A lot of other people see those masks and they relate. And you hear so many people saying that, no, that guy is me. And you realize that so many people have the same kind of concerns and worries. And that, I guess, just looking at the masks and seeing that it's pretty common just helps people to normalize those things.
So let me ask Jada this question, because she needs to share this, and why we actually do the masks, why they're kind of cool, but there's really a purpose to that. And we had a discussion way back when we started to create the program and exactly where art would fit in recovery or the recovery process for the men and women in the military and first responder world. So Jada, you remember that conversation? You want to share about that?
From what I remember, you can correct me if I'm wrong, I think it's just a pretty basic way for people to connect with one another. It's safe. It's out of the box thinking for them. They might feel vulnerable or silly coming in, but I think after opening up a little bit and kind of letting down those barriers, they're able to kind of reset and get some of those emotions out that they've just been bottling up for a while.
Yep. So that's certainly the part that we talked about. The other aspect of it is, which I learned from doing some research, to try to really understand post-traumatic stress disorder and then post-traumatic stress. And those people, like Erica mentioned, that really are severe, are isolated, are kind of entrapped into their own thought process. Most of us could kind of relate to that, but we go in and out of that. We start to ruminate, we start to think. We do that, like I do that. I might do that now. And then somebody's got to start talking again. We'll get Bobby to start talking. But well, we got to get him to stop then. Sorry, Bob. I came on at the certain time. Anyhow, laughter is good. So the point that I want to make, besides what you said, Jada, is the fact that we have all these thoughts. What we have to do is stop that merry-go-round. We have to stop that squirrel cage and then allow that individual to be safe to share those thoughts. We're all very capable men and women, very capable. That's why we got into the fire service, the police, the military, EMS, nurses, flight nurses, military personnel. But what we failed to learn, because it wasn't taught to us, and Bobby knows this better than anyone because he's, I think, the elder statesman here, next to Father Jim. Those are little shots. You gave it back to me later, Bob. is that cumulatively that has an effect on us, right? If we have a cut and we get another cut in that same spot, and then we cut ourselves in that same spot, the doctors are going to have difficulty suturing that period, because that spot, because of the elasticity of the skin. We have learned that diagnosis are a brain disease. And when we're talking about whether or not it be PTSD or depression or anxiety, we have thoughts that we have a tendency to keep to ourselves, some more than others. And that art therapy, that mask, helps create that avenue so that conversation can begin.
And we actually just got a question in on the hashtag FE Talk. And for anybody that's viewing that has questions for Chief DeGryse, Erica, or Jada, or Father Swarthout, just hashtag FE Talk and ask the question. That way we can kind of answer. So we got one question, and it is directed at you, Jada. It says, I participate as a volunteer handler in equine therapy in Maryland. Could Erica briefly explain how that works for those who have never been around horses?
Yeah, I don't,
you know it better than I do.
Yeah, so yeah, we just started bringing out our military veterans, some of which are true Florian clients, probably about 3 months ago. A lot of them get nervous. They're afraid of big animals. They've never maybe been around them, or they don't really know how that type of treatment could help them. So I always just encourage them to keep an open mind. Animals are very receptive to our feelings, and we need to work on trust and being mindful of our energy around them. So a lot of times they come in unexpecting, not knowing what's going to happen. They learn to build trust with an animal and communicate. They learn to care for them, groom them. They learn about them. They work through a lot of fear and anxiety when they are actually riding the animal. Most of them have gone at least through about 3 sessions when they come. So they can comment on how they're building their skills, they're building their confidence, their anxiety decreases, they're feeling hope. A lot of the volunteers there are past clients themselves with substance abuse, or they're military veterans, and that's been an aspect of their life that they'll share openly, has given them hope and has actually like saved their lives. They felt like having that supportive place to go to that they've built a connection with.
So Jada, why a horse?
Well, I think the element that you're able to build trust on the ground with the animal, you don't always ride. You learn how to control and communicate them from the ground first and foremost. So you're learning from the ground up. As you progress, you can then ride them, and it's a whole nother element than I would think adding a dog or a cat for animal therapy, because you're putting your trust in this animal that it's going to care for you. You're learning to communicate with them non-verbally as well as verbally. It's a powerful thing, and if we talk a lot in metaphors here about overcoming obstacles, that's a huge one, putting your trust in something greater than you, which is also a big concept that we focus on in recovery here.
And we're actually taking all the staff out there this afternoon, right after this, to train them, and they can see what it is. So, because it's really important to us that our staff knows what the clients are doing and kind of experiences that I get to do it, and it's really cool. Like, you can you like move the horse with just your body, not like trying to, touch it or lead it or anything. And then it like bonds with you, and then it follows you around. It's like the craziest thing I've ever seen. It's just a really intense feeling that, you're so connected with this big animal. It's very powerful.
I think one of the most moving moments that I've had so far was actually the first time we brought a couple of our guys out. And they were doing the round pen work, is what it's called, where they're learning to control the animal. And the horse actually laid down next to the client and exposed its belly, which is a huge deal because the animal is showing trust in you. So even though this person that's coming in might not have trust with other human beings, or maybe they're not feeling comfortable talking to other people yet about their PTSD or their traumas or how they're feeling, this animal can sense it. And for them to be able to kind of open up and be vulnerable around the person really shows a lot to like what's really underneath that person that maybe they're not even allowing themselves to see.
And there's so much hatred that our clients have because there's so much shame and guilt and just poor self-esteem and poor confidence. And I think, you know, relationships with humans, you know, aren't as outwardly expressive. You don't know if somebody trusts you, and somebody can say something to your face and then mean something entirely different or think something different about you. A horse isn't going to lie to you. And it's so expressive. Like that experience you were just talking about is huge, and it's undeniable. So when somebody says I'm untrustworthy or I don't trust anyone or I'm unlovable, you can say, well, this happened and they did this, so it can't be true.
Yeah, Bill Carey just sent a message, and I didn't know this, and I guess it makes sense, but he said, horses are the only animal that has similar physical movements as a human that can translate to the rider, and that's what makes them so good for therapy.
Oh, I was talking with it muted. Yeah, for sure. I mean, I'll share this with the clients too. I grew up around horses. I have one now, so it's a very active part of my own self-care. Being around them, I'm around people all day, just as many of you guys are. It can be exhausting to be around people and constantly talking, and it's a good time to decompress and kind of just spend time with yourself and your own thoughts. And you have to be on point too, because you know, they're a living animal that can be dangerous. So if you're not really focused on the moment and what's happening between the two of you, you know, things could happen. So it really is a good time to be really be mindful in the present moment.
Absolutely. A peer support team in South Carolina, they just connected with that kind of therapy and treatment. And I think that's neat to see, like, the peer support teams adding those pieces. And so we're looking for the same thing, trying to find somebody who does the equine therapy so that we can add that piece. One thing we haven't done yet, Chief DeGryse, is talk about the symposium and what we're bringing together, if you want to do that. I don't think you even introduced yourself yet.
I don't know if can you hear me?
We can hear you now.
Okay, yeah. No, I think I did. I mean, Dan DeGryse, glad to be with everybody here. I appreciate everybody that's tuned in here. The symposium is the next plan in regards to providing information to the men and women and the families, the chaplains, significant others in the fire service.
Battalion 1 marshal line. Battalion 1 marshal line.
See ya. So Chief DeGryse is on duty, and I just heard him get dispatched to a box alarm. So I guess, Father Jim, you're in charge. You take it from here.
Oh, there we go. Yes, Danny will get called every once in a while. That's what we all do in a way. Did I lose? We all get called. I think you never know when the bell's going to ring. And even in the parish or when somebody's in treatment, you never know when something's going to click. And so when Danny was explaining some of his work, Dan is the director for us at the Florian program. And so really to actually, as I often have said, is bring the family together. And I think that's where you and Bobby and Danny and Erica and Jada, we're all a family when we do this. So that's why I believe in Family House, the Firehouse family, that we all have different skills and different gifts. When the bell rings, we all respond. We all have different abilities. Here comes Danny again. This is Battalion. That was Battalion Chief DeGryse, and I was trying to pick up Danny left off, which is not going to happen. So go ahead.
No, so just to finish up in regards to the symposium is that, you know, 6 years ago, I had the idea of creating the Florian program, and thanks to Phil Eaton, Craig Stallings, all the people that we work with at Rosecrance, we were able to create a venue for first responders and military personnel. But really then the next thing is, it's not to catch it at the back end, but catch it in the front end. One of the things that we do in treatment is educate, and we continue to educate ourselves on a regular basis. Father Jim, you got 3 degrees. You're almost a doctor. You went to school for how many years? 30 years? Anyhow. So our goal really with the symposium, we've done some local and regional trainings, but our goal is to create a venue that people would be willing to come to and learn from not only what we are learning and have learned, but what others have. And this year we decided to, with Captain Dena Ali, to partner with the Raleigh Fire Department, their peer support, and 6 other organizations in the state of Raleigh, or in state of North Carolina, to put on the 3rd annual symposium and provide awareness and education and just really connect. So October 15th and 16th in Raleigh, and you could take it from there, Dena.
No, yeah, I'm so excited. I just got an email today from the Raleigh Police Department, and they've got approval to send 10 people. So what I'm excited about for the symposium is the fact that we're bringing together so many different types of people that can all relate kind of to the same issues and things that, especially in North Carolina, things that this is for us, first one-of-a-kind educational program. We've never had even, you know, one day on mental health. So the fact that we're about to have 2 days and it's going to be all on mental health for first responders from, I was looking at the agenda and it's just so neat. You've got a chaplain speaking. You've got Erica coming and she's going to be talking about treatment considerations. You had to throw me a bone, so you're going to let me talk for a little while. I noticed you gave me the shortest time frame, though. That was smart.
You got 2 of them.
Oh, yeah, I forgot about that one. And then you've got 3 law enforcement officers speaking, and all with very diverse experiences. So it's just going to be, I think, just so much valuable information and just such an awesome way to bring us all together. And we're working for Monday night to have a little live music and another way just kind of bring everybody together socially. So it should be go ahead.
So one of the things we talk about, Dena and I and everybody here, is about connection. Who do you connect with? One of the things that I've learned from peer support, the Jada and Erica have learned in regards to being clinical. Father Jim knows from his pastoral years, and Dena, you've learned in regards to both being a law enforcement officer, but in the fire service, is how do you relate to somebody? How do you connect with somebody, regardless of what you know? So really kind of what I want to, and not take the reins here, but really ask everybody in a sense of connecting with somebody. And we're talking about interacting. We all have stuff. Like if I asked everybody here what's going on in their lives, we'd need 6 hours to talk about all that. I need a little bit more than 6 hours. But what have all of you learned from personally and professionally in regards to intervening in somebody else's life?
I would say very much just it's fellowship, having a relationship with trust. And it takes time to develop that trust. So when I talk about that fellowship within the firehouse, within the family, we have fellowship, people we like and we don't like, and people we struggle with and people we align with. And our ability, the most important thing that we can do is a sense of fellowship. That takes time, though. Sometimes that hurts. But yet again, I think sometimes the people we disagree with in recovery, we also become more aligned with them because we find out that we're not ourselves. And I think that's an essential aspect. So at our unit, when we get together with our Florian unit at Rosecrance, what we do is there 11, 12 people on the unit. We all have a conversation so often. And it's so fascinating to watch people who don't know each other all of a sudden hug and walk out the front door when we leave treatment, knowing each other. And that happens with just a myriad of just different therapies. What Dena had talked about, what you do, Jada and Erica and Dan, you align hearts so that we have new knowledge, and so then we can move away. So I was trying to help Bobby understand the past. Our purpose is not so much to preserve the past, the pains, the hurts from the past, but to change the present for the good of the future. With new insight, new understanding, we can have a greater sense of joy and hope for others. So that takes time, though. It's aligning with each other. It's fellowship.
Yeah, I think, I guess what you're asking, one of the biggest things I learned is, or that you see, is when you can actually come together with somebody else. It doesn't matter if they're like you, similar age, similar rank, similar even job, but when you can sit down with somebody and have just meaningful conversation where you don't feel judged, all of a sudden, just being able to have that meaningful conversation, it just normalizes everything and it makes everybody a lot more comfortable.
Yeah, I think we talk a lot about building rapport when you talk about counseling and therapy, and that basically just kind of means relationship. And that's the most important piece of the therapeutic relationship between a client and a counselor is that rapport. And what that means is just the ability to trust somebody, trust that they're being genuine, trust that they have your best interests in mind, and that they're advocating what's going to be best for your needs, and also that they're not going to co-sign on some of your unhealthy thought patterns, and they're going to call you out, and because we're supposed to be genuine. And if we disagree with something that they're saying, or think that something that they're doing might be unhealthy, you know, it's our role to tell them that. But in so doing that, they trust that we're being genuine. I guess, you know, you connect with people by just being real and being authentic.
Jada?
I think Erica covered the rapport building pretty well. I guess, yeah, the only thing I could add to that is just people can tell when you're not being your genuine self. So like helping people feel supported and encouraged and to be themselves while they're here. They can tell if we're here for the right reasons. And I think hopefully people get a good sense of that when they come in here. I think through the group setting too, I observe a lot and listen and try to gently pull things out from them that they exhibit, whether it be that they have a hard time asking for help, or they use humor a lot like we discussed, and kind of bringing that back around to where does that affect them in their daily lives, and how can we help them see and guide them to an understanding of that, so that it's kind of a gentle way to help them grow.
So all that stuff is great stuff, and I'm just going to share with you my thought, and you could go from there. Any of you can answer. Is that getting in the field of counseling back in '86, I thought I had some background, some intelligence, and something to share with them. And what I realize is if I don't connect with them, if I don't listen to them, if I don't hear them, they're not going to listen. I know with me, if I'm talking to somebody and they're looking at their phone or they're looking around, and I have a hard time paying attention. This hour here is going to be tough, not only because I'm at work, but because I just know myself. I have too many thoughts in my head, and that just comes with age. But I have to intentionally focus on the individual, kind of look at their face, look at their eyes, look at their mannerisms, and really listen to them. I didn't do that very well, and anybody that's watched my FDIC keynote didn't do that well with my wife for many years. And so I have to, so in regards to intervention, in regards to being a peer supporter or a clinician, I know for me, I have to sit there and basically say, hey, how can I help? Not think that I can help, but actually ask them what they're thinking. How can I help them? And that will give me a whole lot of insight. That simple question will give me a little insight on really what they're looking for. Okay.
I wasn't going to interrupt that time. I wanted to give it a little bit of time. We did have another question, and I'm not familiar with this, but somebody asked if Rosecrance carries a PATH certification, P-A-T-H.
I haven't heard of it.
Okay, so that's with the equine therapy. So yes, the facility that we go through is PATH certified. So the instructors that we have on site are PATH certified. Okay.
And Dan, just so you know, you've only got 12 minutes left. You've made it pretty far along on this. So we want to try to get kind of wrap up and get the information across that we wanted to get across. So we hit on the Rosecrance Florian Symposium. That's going to be October 15th and 16th in Raleigh. You cut the registration price in half with the move, which was really cool. Just something else that I guess I thought was fascinating for me to learn, and maybe hopefully you guys can explain, but just talking about Rosecrance in general in your treatment center, before I got to know you and before I went out there and toured it with you, I really and truly didn't know that there were differences between treatment centers. I really thought they were all the exact same. So do you mind just kind of talking about the differences and what people should look for? And something else that I learned that I thought was great is if somebody contacts you guys and they might not be a right fit, you guys will help them get into an appropriate facility. So I think it'd be really important for you guys just to talk about those things.
So, yeah, in regards to what you need to look for in a treatment center or when looking to get help, you should definitely look at a facility that is accredited, that's licensed, that has what's called a JCO accreditation. And what that means is that we have this kind of governing board that comes through and does reviews regularly does chart reviews and monitors our processes to make sure that we are providing what we say we are providing. It's also important that the counselors and the staff is trained to provide the things that they say that they're providing. So our primary diagnosis is substance abuse, so we require all of our staff that is in direct care of the clients to obtain a certification of being a drug and alcohol counselor within a year or 2 years, depending on their role of their position here, so that they can say that they're an expert or that they know what they're talking about. Also looking at the treatment program in general, we have a certification agency called DASA that is in Illinois state drug and alcohol funds. They kind of make sure that we do what we say that we're doing, and they require a certain number of direct treatment hours. So that's psychoeducational groups, that's process groups with a licensed counselor throughout the week. And I think we looked at our schedules and we provide way more than that. So if you're going to a treatment center and they're saying that they're giving them 2 hours of group a day, then that's really not treatment. That's not residential level of treatment. So making sure that people are giving what they're saying they're providing. And making sure that the treatments that they're using are evidence-based. It's not just something that they're coming up with or that they feel is okay. It's something that research backs up, says what it says it's going to do.
Let me just add on to that. That was a good explanation, Erica. So one thing, being in the field for really the last 32 years, I'm getting feedback now. So if anybody comes in and tells you that they can do everything, that's a red flag. We do not do everything. I give an example. So we don't handle eating disorders, or for our adult population, we don't deal with primary mental health issues. We deal with co-occurring, but if it's the primary issue, we would refer out. As Dena mentioned, I can't tell you the number of calls that we get and how many we refer out, but we refer out significantly. And what that means is we have to know all the other individual counselors, partial programs, outpatients, inpatient programs, to an EMS person, a police officer is going to do is say, hey, I'm going to let the next person handle it. Rosecrance does not leave somebody to find that out themselves. If they call us and we are not the right fit for them, we will try to get them to the best possible place. But again, we don't handle everything, nor should anybody else. It's just like if people ask me all the time, do we handle primary mental health diagnosis? No. For our adolescent site, we just recently did that, but there's a number of things that got to come along with that. The first thing is you got to get the licensing. The second thing is you have to have the right staff. You have to have people that not only have an understanding of substance abuse, but you have to have clinically sound people that have that background, not only from a educational standpoint, but a clinical standpoint where they have experience dealing with acutely mental health issues. So when people have asked me about is Florian or is Rosecrance going to do that, it's a process. It doesn't happen overnight, and it has to be intentional, because I always say to people, hey, stay in your lane. Do what you know is good. Don't just do it because it's the neat thing or the thing that you want to do right now. We want to make sure that if we do it, it's done well, and that's why it took a couple of years to start the Florian program.
No, I think that was really good, because no matter how much, it took me a year to understand what you guys do in just a little bit, and I don't have much of an understanding. So to know that there's somebody there that can get somebody to where they need to go, even if it's not your facility, that's big. And I guess, I'm the director of our peer support team in North Carolina. And just because you and I have a good relationship I know that if I have any problem, I'm going to just send them straight to you, and then you'll be able to go from there, and or help direct them to where they need to go. And that's big to know, because that's one of the scariest things for peer supporters, is being able to know where to send somebody, or being able to know that you have all the right resources. So I think that's one of the reasons that I just have a little more amount of trust in Rosecrance, and it's just because I have that personal relationship and I know who you guys are. And it's pretty neat that the director of the Florian unit is an active duty firefighter. That helps. So
we appreciate that trust. We know it doesn't come easy, and like you said, treatment is not treatment like is treatment. It's like saying every firefighter is the same. That's not the case, based on experience, based on previous experience. You might have a candidate or a probie in your department, but they might have 10 or 12 or 15 years from a volunteer department. I want that person, as long as they don't have to unlearn some bad skills per se. We all have things that, quirks, but some people would rather have somebody from the very beginning and teach them. But what I'm saying is that people have to have that experience. I know you had another question.
Yeah, and I think Father Jim, this one will be good for you, and it's a really good question. Chris Baker says he's looking for counseling programs for spouses and significant others. What kind of programs does Florian provide? And it was kind of ironic that he asked that question, because I just reached out to Chief DeGryse yesterday, because we had a spouse that was having issues with their husband, who's the police officer, and he's not opening up, and she knows he's going through some really hard times after a really bad call, but she can't get him to talk. So what kind of options are out there?
We certainly have family program within the Florian program that connects the family client that may be in treatment, as well as the family to treatment and treatment to the family. We offer resources, individual as well as group therapies. But I think the key is that we have resources throughout the country. Family members and friends throughout the country, being a 100-year organization, being connected to fire services and police departments and men and women in uniformed services. We understand those professional people that are all out there. So we all connect on a professional level. So if in fact somebody is looking for an intervention, or I would call it invitational intervention other than a confrontational behavioral approach, is that what we really do is we do the invitational process, that we have relationships throughout treatment centers and counselors throughout the country, because we're so large. We have over 1,200 people on staff. We, as well as they were saying earlier, 52% of our staff are all master level throughout the system. So and with over 62 outpatient places as well as inpatient. Actually, I'm in Chicago right now, and I believe Jada and Erica are out in Rockford at our Florian program, and Dena's in Chicago someplace or wherever he's at. We have those relationships all around that we can support people. That's an important aspect. The family, the individual, because it's a family system that we're trying to bring together, that they can all have joy together in a new life.
Yeah, certainly in regards to recovery, whether it be substance abuse, mental health, or relationships, it's about the relationships with our spouses, and it's important that we engage them in the identified person's recovery process. Some, I'll be honest with you, some don't want to be involved with that right away. Some need a break, but we always, and Erica could speak to this because she was a primary counselor for many years, and I know Jada has met with them, is that our goal is to help educate them and mend that broken relationship. So, because we're all bound by the fact that we want to be with other people. So spousal support and family support is huge. Many of the people that honestly come into the program, unfortunately, are either at the point where they're going to maybe lose their job, get suspended, or lose their family. So spousal and family is critical, and that's why we offer a 2-day, I think it's 7 hours on a Saturday and Sunday each. It doesn't have to be consecutive, but to offer them time to get an understanding of kind of what about recovery, and they can come as often as they like. And then, as you mentioned, you don't necessarily have to talk to a counselor. You don't have to talk to a therapist. You might want to just talk to the spouse of a first responder. And that's what I connected with you yesterday. And then if we don't have somebody in our area, believe me, I could reach out to you or people in Houston or Canada or through the network of the IFF peer support, Illinois peer support, North Carolina, and connect them with somebody that probably has been through the same thing or going through the same thing that they could relate to.
Absolutely. And I think that is something, when we first put our team together, we neglected it. We didn't think about the importance of spousal support. And about 5 months ago, a spouse had reached out to us for her husband. And we realized how important it is to have that network, or if spouses are seeing somebody or seeing something, just to have somebody that they can relate to. So when building the peer support teams, it's really important to have that component to the team of spousal support. Did you guys, when you created your team with the local 2, did you guys have that group?
We did not have a specific spousal group, but what was important for me is that I had somebody that represented pretty much everything. In the beginning we did, and then the other thing to keep in mind with peer support is, I'm forgetting the word now, long-term peer support in a sense. So we had men, women of all ranks. I remember calling, and this is not necessarily spousal, but I made sure that I had a deputy chief or a district chief. And some people might say, well, why did you do that? Well, guess what? When you're in that position doesn't mean that you don't have stuff, whatever it may be. So it's important for a peer team to have all those entities. Does that have to happen immediately? No. And do people fall out of the peer support? Absolutely. So it's important to build a program and then work on it on a continual basis. It's just like your lawn. You don't manicure it one day and cut it one day and it stays pristine. You have to work at it. That's the same thing with your team. So anybody that becomes a lead self, and we've had this discussion, and anybody that's a lead peer supporter knows this. And if Casey Ellsworth from Dallas is watching this, hey, Casey, how you doing? The reality is it's a lot of time and energy and hard work, and you have to maintain that.
No, that's definitely the hard lesson I've learned. Is it is a lot of work, but it is, what I'm seeing is it's so rewarding, and it's just like planting a seed. It just continues to grow. And that's what we've seen. And we just had a member that came through our last training that's completely stepped up in so many ways. So when you first put the team together, you're not going to have all those resources, and you don't really need to rush to have them all, because if you rush to try to get everything in place, it's not going to be the quality that you want. So it's just about starting small and then slowly adding on to it, which it was kind of neat that we talked about the equine therapy, because now that's the next thing that I want to find is somewhere in the state that we can do that. And the next piece is adding that spousal team and just slowly building onto it with people. So we have made it. It's after 2 o'clock. So we need to wrap up a little bit with any kind of closing thoughts. And I think what's really important, since we talk so much about Rosecrance, is how can somebody get in contact with you guys if they need help, or if they need help finding a place to get help?
Yeah, it's pretty simple for us. All you got to do is call 815-391-1000. And I could say that again. I can't put it on the screen, but 815-391-1000, or you could look up Rosecrance and they'll direct you to us. And again, we're not the only place in the country. We get that. What I do want to say about that is it's not all about this, but I couldn't be prouder of the people that work with us to develop a program anywhere. And you know this from being a peer supporter, and Father Jim knows this from a congregation. That is not easy. Some people want to develop these programs, but it takes time and energy. And the 2 ladies that are sitting there, they know, because I share about them. They don't have a year experience. They don't have 2 years. They have 16 to 20 years of schooling, plus 10 years of experience and personal experience. Something that Jada didn't share is she's been around horses her entire life. We don't just jump into equine therapy. We research it. We find out whether or not it's something that we're going to do. She loves it, and it's been doing great with the veterans. And we want to, but you have to find the right program to partner with, and she did. But that was over time. Everybody here. So when anybody goes to look for resources, ask them the hard questions. How long have you been in it? Why are you in it? What have you done in your history? Are you why are you passionate about it? We revised our program 3 times. Ask Erica. And sometimes it could be daunting, but you have to do that to be in the current, most evidence-based practice. And sometimes, I mean, you have to evolve. If you look back 100 years, any of the top 100 businesses, probably most of them aren't around anymore. Rosecrance has been around for 101 years. There's a reason for that. And it's because of people like that. But there's other ones that are good. But you got to be able to, as a peer supporter, as a family member, to ask those questions about, okay, why are you recommending this level of care? What is the benefit of this? Who are going to be implementing the program? What is the program? How long is the program? What are the types of therapies? And we'd have to have a whole nother class or hour or two to talk about CBT or DBT or CBT for B. You know, there's a whole bunch of acronyms. So we can certainly do this again. Hopefully people watch this, and thanks to the people that took the time from their day to watch us, and thanks to the people that are part of this panel, as you as well, Dena.
Sorry, I forgot to unmute. Erica and Jada, do you guys have any final thoughts? Anything that you want to add?
I just appreciate being able to be here today to talk about what we do. We do it because we feel passionately about it and we believe in the cause. And honestly, I feel really grateful for the opportunity that Dan has given me and my boss Craig and Rosecrance in general, and being able to work with this population, because honestly, you just don't think about that and all that stuff going on until you actually break it down and work with them and see what's going on for them. And so it's so nice to be able to give back and help others and people who give so much to the communities that they serve. So it's just very rewarding. So thank you for having me.
Yeah, thanks again also, Dan, for asking. Something that you guys mentioned too was in looking for a good place for treatment is the staff that works around it. And I think a lot of our staff here are either personally connected to the fire service or police or whatever. I didn't mention my husband used to be a volunteer firefighter, so kind of having that feeling a bit connected. We all have a reason why we're here, so hopefully that shows through with our work too. So thanks for having us.
I would echo that, and it's really mustard seed recovery, because I believe we start slow and then we build it to the largest of plants. And I think Dan and the other people around here, my father was a volunteer fireman, was a fireman for over 30 years, and he even talked some of his experience today, even about some of the traumas and experiences that he had. I grew up in the firehouse. So, and look what happened to me. I put a collar on instead of a fire hat. So that's another story.
It's a helmet, by the way.
Yeah, okay, helmet. Here it starts, everyone. Stay happy.
Yeah, this hour flew by. It was really awesome having all you guys and being here with you. Something I just want to throw out to all the viewers, because this actually, people will be able to go back and watch this for weeks to come. So something I want to throw out, especially for people who are involved with peer support, is that if you ever want to tour the Rosecrance Florian unit, Chief DeGryse will be happy to give you a tour. When we first met, that's kind of what I did. I went out there and got a tour, and I think you can't really understand it until you actually kind of walk around and meet the people there and see what it is there. So if anybody is interested in learning more about that, email him at ddegryse@rosecrance.org. And then of course you can connect with all these other people and ask whatever questions you need. Go ahead, Dan, I heard you unmute.
Oh, no, I was just going to say that if in here, there's a lot of really neat things out there to talk about. If you, and I'm not saying that I want to be on this, but if you want to be a part of this, if you want more of this, if you want a certain thing that we didn't cover today, because it's, really that hour goes by so fast, email Bobby or Fire Engineering and put it on the docket, and we'll try to provide it. This is really this is for all the men and women and the families in the fire service and any other first responder military personnel to have really the the reason I got in this thing is I didn't want somebody to be sitting in their house or their apartment or on a park bench or their motorcycle and not know who to talk to. Forget about post-traumatic stress disorder, forget about depression and all that stuff, but to have a conversation, who do you go to? Hopefully with the symposium, hopefully with conferences, hopefully with people like Dena, hopefully with the North Carolina peer support team, there'll be more as time goes on, because 10 years ago, you could Google peer support in the fire service, you could Google peer support, and it wasn't there. Now it's here. So thanks for listening.
All right, that's the wrap. Thank you, guys. We'll see.